Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. Welcome to Contagious Chronicles by NFID, featuring insights from trusted experts on the latest developments in infectious disease prevention and treatment. With me today are two esteemed colleagues and NFID leaders, Medical Director Dr. Bob Hopkins and NFID President Patsy Stinchfield, to talk about the alarming recent increase in measles cases, despite the elimination of measles in the U.S. in 2000. Measles, a highly contagious and potentially serious disease, is now making a comeback due to low vaccination rates. So thanks so much for joining me, Bob and Patsy, and for talking with us today about measles.
Happy to be here, Marla.
Thanks for having me.
So, Bob, I'll start off with most of us have never even seen a case of measles, and many underestimate its severity. So can you share some general background and what is measles and why we should be concerned about it?
Measles is the most contagious virus we know about. It's a virus that only affects humans. It's transmitted person to person by airborne and droplets from an infected individuals. Common presentation is with fever, cough, and red eyes, followed by a rash on the inside of the mouth and on the face that then spreads to the trunk and the rest of the body. The rash appears about 2 weeks after you're infected, and people are contagious from about 4 days before the rash appears to 4 days after the rash appears. In the days before vaccination, it was a very common cause of hospitalization in children. Those rates are down now because we've had less disease, but measles is still a serious disease. Unfortunately, in addition to causing hospitalization, it can cause brain swelling, immune system damage, which places children at risk for subsequent or following bacterial infections, and a small number of children die or have a delayed brain injury, which may not show up for as long as 10 or more years.
So, Patsy, the measles, mumps, rubella, or MMR vaccine is highly effective at preventing measles. So why are we seeing so many cases this year?
Yes, after 2 doses, the MMR vaccine is 97% effective in preventing measles. So no vaccine is perfect, but this one is pretty darn close. We are seeing more cases because, in short, not enough people are current on their MMR vaccine here and abroad, around the world. So we're seeing more disease in our communities where those vaccine rates have dropped. Anything below a 95% coverage rate in a community allows that virus to enter and spread. One case can spread up to 18 other people. If unvaccinated, 90% of those exposed will get measles. It really is all about our dropping vaccine rates. We really got to get those back up.
Yeah, and Patsy, I would add, the challenge is not just here in the United States. There are outbreaks happening all around the world. And that's likely the source for many of these imported cases we're seeing popping up across the United States.
So, Patsy, since the MMR vaccine is recommended for all children starting at age 12 to 15 months, what can new or expecting parents do to help protect infants who are too young to be vaccinated?
Yes, it's really a good point that we'll always have infants too young to be vaccinated. So we always have a vulnerable population. First, women should receive their MMR vaccine before becoming pregnant. This will make measles antibodies that just beautifully cross that placenta and protect that baby for the first months of their life. However, these antibodies wane relatively quickly, so that 6-month-old through that 11-month-old baby is really at risk and flying on their own. They have little to no protection. So if you're in a state that has a measles outbreak, there may be an outbreak response to lower that 12-month first dose to 6 months of age for protection, and sometimes we've even gone lower than that. Also, any baby traveling internationally who is 9 months of age or older can and should get an early dose for protection. That'll need to be repeated at that 12 months age in kindergarten usual schedule, but that will protect babies when traveling internationally. As Bob said, that is likely where most of our cases are coming from. So communities vaccinating themselves not only protects that individual, but also those babies too young to be vaccinated, pregnant women, and those with immune deficiencies.
So, Bob, what about older children or adults who are unsure of their vaccination status? Should they be vaccinated?
In short answer, yes. If you don't know that you've received a full 2-dose series of measles, mumps, rubella vaccine, MMR vaccine, you should be vaccinated. I have frequently had questions from patients in my community about whether they should get a measles vaccine. I've had questions from people that say, I think I had that as a child, but I'm getting ready to go on a trip internationally to X. And I've said, you don't need to ask me anything more. We need to give you an MMR vaccine, because if you don't know that you've had those 2 full doses, to get to that 97% protection, you need a dose of the MMR vaccine.
And Bob, I think about 2 populations I would add to that. Those born before 1957 almost all had measles. So that confers lifelong immunity. So those individuals that are older, like me, are probably protected. The other group I worry a little bit about are those babies that were born in the early 1990s when there was so much disinformation in the public eye about MMR vaccine and false information about its potential causing autism. I hope that those babies born in those 90s are checking their vaccine schedule and making sure they're all in their 30s now, were in fact vaccinated back then. And if you're not sure, you can certainly ask for a measles titer to be drawn at your clinician's office.
I think that's great advice. Bob, what advice do you have for people who live in communities where outbreaks are occurring? And if there's a measles case in your child's school, what should you do?
I think about this situation in 3 pieces. The first is check. Make sure everybody in your family, and really everybody in your sphere of influence, your family, your friends, your contacts, anybody you can influence, if they can be vaccinated, they are vaccinated. And if possible, I think it's particularly important to have vaccine records, because that gives you some validation. Second, if you or somebody in your family is unvaccinated, reach out to your healthcare home, your primary physician now, to get vaccinated or to get advice about whether you may need alternate protection. The vaccine is safe and effective in almost everyone, but persons who have a weak immune system cannot be vaccinated, and pregnant women can't be vaccinated during pregnancy. Third, you want to listen to our reliable public health authorities for advice. There has been some bad public health information out there, but in general, public health advice is very important. If you're exposed to measles and unvaccinated, you need to be isolated to prevent spreading the infection to others. And if the infection or the exposure is identified early enough, vaccination or immune globulin, otherwise known as antibodies, may help prevent you from developing measles. And if you've been exposed or you're in a school where there's some measles and you have fever or other symptoms, make sure that you reach out to your healthcare provider and talk to them first by phone before you show up in their office to get tested, because we don't want to take a chance on spreading measles to others.
Yeah, I would just really underscore that last point, Bob. As a nurse practitioner in infectious disease at a children's hospital, I had to manage a lot of these outbreak cases, and that call ahead makes all the difference in the world. If your school has measles, your child now has fever, cough, runny nose, watery eyes, assume it's measles until proven otherwise. Keep them home, call your clinic. If they're so sick that they need to go to the emergency room, call the emergency room and let them know that you're on your way. They will promptly meet you outside, put a mask on you and your child or a blanket over a baby's head. They'll take you into a negative special airflow room so we're not spreading measles in that waiting room, which can stay in that lobby for 2 hours after a person with measles has left. So we really need to make sure that we're not doing spread in healthcare facilities. If that measles does get diagnosed, these kiddos can get, if it's been within 72 hours of the exposure, they can get an MMR vaccine. They can get some immune globulin within 6 days, MMR vaccine within 72 hours. And if they get that after being exposed and their symptoms resolve, they can return to school. So if not treated with post-exposure prevention measures, these kids will need to stay home from school for 21 days so as not to infect others. So again, isolate, vaccinate, think of others.
Short and simple, easy to remember. Patsy, one last myth that I know we hear a lot, but can vitamin A be used to prevent measles?
No, it cannot. Vitamin A is not used for prevention of measles. The only thing that prevents measles is measles vaccine, MMR vaccine. So there is no antiviral medicine to treat measles like we have other antiviral medicines for other diseases. However, we do use vitamin A. It would be prescribed by a clinician, usually in a hospital setting, and needs to be given promptly once that measles diagnosis is confirmed. Vitamin A after the diagnosis really does reduce the severity regardless of where you live in the world. Vitamin A, however, does not prevent measles. And so there's a lot that we did as NFID on this topic. To read more about it, the doses, when to give it, how to give it, you can go to nfid.org/measles.
Patsy, I agree with you that vitamin A is so important, but we don't want people going out and getting high-dose vitamins to give to their kids just empirically. When vitamin A is used for measles, it should be done under the supervision of a healthcare provider, generally in a hospital setting.
Absolutely.
So before we close out, I'll ask if you have any other words of wisdom to leave the audience with.
Yeah, I'll start, Marla. I would encourage anybody listening who's not been vaccinated or has children who've not been vaccinated to talk to their healthcare provider. Get reliable information about MMR vaccine. Make sure that they're protected against measles and that all their other immunizations are also up to date.
And I would say we are all in this together. The rest of 2024 looks like we're going to see a lot more measles cases. So here's what we all can do. Individuals, check your vaccine status and get vaccinated if you haven't had 2 doses of MMR. Clinics and hospitals, are you ready? You know what measles looks like? Would you know how to isolate, test, and manage with vitamin A? Pharmacists, are you current on your vitamin A doses and knowing how to manage them? State health departments, are you communicating in science-based guidance to prevent spread, which is to isolate and vaccinate? We are all in this together. So we do not want to see the return of this disease. We all have something we can do to prevent it.
Thanks again for your valuable insights, both Bob and Patsy, and thank you all for tuning in to Contagious Chronicles. If you have a burning question for an NFID expert, please submit it via the online form at nfid.org/contact, and your question may just show up in a future episode of Contagious Chronicles.